Well, we've said it before, but looks like Public Health England has officially, thanks to Matt Hancock, or, just a couple of different letters changed to his name, and the meaning of his word changes completely. I'll let you do the imaginative stuff. But we were warning about this for a while. Sooner or later, the Tories, the pandemic that we have currently, is their fault. That we had austerity, which led to a lack of funding for things like Public Health England and the NHS, which has in turn led it to not be able to function in the way that it would need to during this crisis. And as a result, we've ended up like this. And it's just been absolute madness, nonsense. Most of the stuff that has been going on has been directly because the institutions that we have had to defend us from pandemics have been criminally underfunded. And now, today, Public Health England has been officially started to go. And the blame game, as we said, Public Health England is not to blame. They did everything they could with, imagine a department in a business or a workplace that essentially once had 20 staff and could do its job, had now been cut down to 5 staff, and they was trying to do the job of 20 people. That's the situation that Public Health England was in. And something in the article that we're going to go through here of what exactly we lose from losing Public Health England. In the UK, we have a really good tradition of when we have of public health, and not just for something minor, but for the whole country as a whole. And this works for us long term. Now, we've said before, the Tories do not like long term stuff. And this is what seems is going to be happening to Public Health England, that it's now going to become a short term, quick organisation that doesn't think long term of public health. But that's the tradition we have in the UK of things like this for public health to be long-term projects and institutions that develop those long-term initiatives. And that is one of the things we are going to lose from losing this, institution. So, anyway, we're going to go over what it is we're exactly to lose. And this was from The Independent. And it's after Matt Hancock's snap decision to axe Public Health England. This is everything we could lose. As a lecturer in charge of the public health curriculum at my medical school, I was shocked by the news on Sunday morning that Public Health England will be disbanded, especially as it appears to be on the chopping block for no other reason than as a way for our current government to save face in many of their failures during the pandemic. That public health can be so badly interpreted, willingly or not, has only in infectious disease control highlights how poorly understood public health services are by those in power. In the 100-odd years since public health has been on the medical radar, in Europe at least, it has done much more than prevent the spread of infection. Public health measures are responsible for an increase in our average lifespan by decades and have improved the lives of millions of children and adults by preventing meaningless illnesses using screening programs, health promotion, testing, vaccines, and social care reforms. This is because recovering from disease, illness, and ill health takes more than drugs and surgery. Instead, how we keep Britons healthy in the long term is a complicated grouping of prevention programs, social care support, in and outpatient services, and public service initiatives akin to playing chess on a roller coaster. Every move affects the overall game, and the whole board can be disrupted at any time by national and global health emergencies. That the government has chosen to axe Public Health England just after announcing a national incentive to fight obesity shows how little it understands the important role that Public Health England plays in maintaining our overall health and well-being. Initiatives such as the anti-obesity programme are what they're called health promotion. Health promotion programs promote behavioural changes that improve the overall health of the population. And we are familiar with this. Many initiatives, such as the 5-a-day initiative, the Couch to 5K, and the many smoking cessation programs currently are available for free. Those action plans target changes to individual health that result in a healthier population overall, and as a bonus, the less overstretched NHS when it doesn't have to deal with the consequences of these diseases. Screening programs are another essential non-pandemic service supported by public health, like health promotion screening for disease at points when the disease is likely to be caught earlier and best managed. Cancer, for example. This means fewer people suffer from the advanced disease and more people survive than die from these diseases. And again, the NHS benefits from increased availability to treat disease quickly, effectively and efficiently. And, more importantly, cheaply. To do this, Public Health England runs screening services, testing and laboratories across the country. Finally, Public Health England holds a wealth of information and research on keeping people healthy and safe in their home and work environments, promoting and contributing to the safety initiatives in all sectors. These three examples are only the tip of the public health iceberg. In the UK, we have a tradition of public health that has almost nothing to do with pandemics and everything to do with improving the health of the nation as a whole for the long term. I could continue at length about the importance of the non-pandemic role of Public Health England plays in our daily lives. However, perhaps it's most effective to see what can be lost when we equate public health with pandemic response alone. Public Health England currently has close to 60 targeted programs in place to improve health and well-being across the whole population. And here we are, just the highlights we are probably going to lose so that our government can save face on its its poor response to the global pandemic. For me, any loss of any of these services is a much too high a cost. And I sort of agree with him, on this. This is important, and those, as he says, those are just three of the main things. It is important to have awareness programs for these type of things. It's important to have screening programs so that you can catch disease earlier. This, I would say, Public Health England, and this is something that we have drastically underestimated in this country, that Public Health England is just as important as the NHS, if not more so. Because if you have Public Health England providing all these services, all these really essential services, which in the long run help save pressure, and cost on the NHS, then disbanding Public Health England is going to have a knock-on effect on the NHS itself. Now, that won't be immediately noticed, but over the long term, that will have an effect. And what is Public Health England going to be replaced with? Well, at the moment, it's the typical Tory policy of, we'll replace it, and then nothing else comes afterwards. I highly suspect that all these laboratories and all this stuff that was once operated by Public Health England is suddenly going to become run by private corporations, because this is how the Tories operate. They find excuses like the Public Health England, over which of the past 7 years has had its budget cut by over 40%, and now they claim that, it's Public Health England that was in the wrong. And yet, I continually say this, there is going to be a reckoning on this coronavirus, and it will come in the form of a public inquiry. And I guarantee you, it is all going to fall at the feet of the government, because Public Health England reports to Matt Hancock. And Matt Hancock was the one who was asleep at the wheel. He was the one that decided, and part and parcel of the Tories that cut so much money from Public Health England. And now that's what we're left with. We're left with an organisation that I would argue is just as crucial to our country as the NHS is, and yet here we have just left up to the audience, to the general public, it's just gone like that, just to try and save face. And I've said it before to a certain someone who disagreed with me and said that it's impossible. The NHS and our health system is too big. Easy. You get rid of something like Public Health England, and all of a sudden you have these thousands of contracts that have suddenly become up for grabs for private companies. They don't have to sell off the whole thing. They just have to destroy it, and then they can sell it off piece by piece by piece. This is what the Tories do. This is what the Tories have done to Public Health England, and it is going to be an absolute travesty for the coming years of the UK as a whole in its public health, and that as a whole is going to suffer drastically.